These are exercises for elbow, forearm, and wrist rehab for range of motion. The first exercise is called wrist ABCs on the wall. For this exercise, the patient will rest the forearm on a table or up against a wall. Then they will take the hand and begin to draw lowercase letters of the entire alphabet on the wall with their hand. If this becomes easy, do the same exercise, but this time draw capital letters of the entire alphabet. And if this still becomes too easy, progress to the same exercise, but this time draw shapes until you have been able to gain full range of motion in your wrist. For the second exercise, we're going to do wrist normal ranges of motion. For this exercise, the patient will do the same thing with their hand hanging off the side of a table. They will then try to take the wrist through all of the ranges of motion pain-free 5 times. So we'll go through hyperextension, extension, flexion, ulnar deviation, and radial deviation. When this becomes too easy, the patient will then have a partner help them through the same ranges of motion, trying to push them a little farther than the first 5 times. And if this also becomes too easy and pain-free, the patient will now have their partner resist the normal ranges of motion. The next exercise is elbow wall slides. For this one, the patient will place his or her hand on the wall and place their uninjured hand under the injured elbow. For the first exercise, you will be doing this with support from a partner. The patient will then slide their hand down the wall, allowing the elbow to go into flexion while the other hand guides the elbow down for support. The next progression for this exercise is with just gravity as your resistance, as you do the same kind of movement. And the third progression for this will be with a weight in your hand going through the same motion. The last exercise is called elbow hangs. For this exercise, the patient will lay their arm on a table with their elbow, forearm, and hands hanging off the side, holding that position using just gravity for 2 minutes. When this becomes comfortable and easy, the patient will progress to doing the same exercise, but this time will hold a weight in their hand for 2 minutes. If this still becomes too easy and comfortable, they will progress to weight and resistance similar to PNF stretching. So the patient will contract and release against the resistance of someone else.